Hi, everyone. I'm Sherry Graziosi with the Frederick Scanner. Thank you for joining us today. My guest today is Congressman Jamie Raskin of the 8th District of Congress. He's our congressman here in Frederick County. Congressman Raskin, thank you so much for joining us.
Sherry, I am delighted to be with you. Thanks for having me.
As we go on the air, the latest numbers in Frederick County are 765 people have been infected in Frederick County of COVID-19, and sadly 35 have died. The numbers continue to go up. Governor Hogan sometime today will be talking about reopening Maryland, keeping in mind the federal government's proposed recommendations on how to open it. But you're spearheading an act called Reopen America Act 2020. And I was wondering if you could tell us about that.
Yes, Sherry, thank you so much for doing this. Well, a lot of the money that we've spent so far, and we're headed towards $2 trillion, has been about throwing an economic lifeline to the people. It's small business aid. And yesterday we just proudly voted for hundreds of billions of dollars of more money for small business. It's unemployment insurance to keep our people going. It's big business aid, and there's going to be a lot of that the Department of Treasury is going to hand out. But of course, what the economy really needs is for us to get over this crisis, to get out of the public health crisis, so all of us can get back to work, so we can reopen commerce and education, K through 12, universities, social life generally. And so the health of the people and the health of the economy are integrally intertwined. And so when people frame it as, well, should we be spending money on the public health or should we be spending money on the economy? It's a false choice. We've got to bring the economy back by overcoming the COVID crisis and successfully combating the disease. And what we've been missing up until now, Cherry, is a real nationwide plan on how to reopen America. And that's what the Reopen America Act tries to supply.
Do you have bipartisan support on that?
Well, not yet. I mean, we've just started. We do have 65 members who joined on. Let me tell you about the basic elements of the plan. The president, I waited for the president's plan, which was last Thursday. He said he was going to unveil a plan. But his plan totally dodged any responsibility for the federal government. His plan was just some ideas for how the states can do their reopening. But there was nothing about coordinating the states. There was nothing about the federal government making sure that the states will have access to the health equipment that they need, like the PPEs that the doctors and the nurses and the frontline providers need, or the ventilators that the patients need. There was nothing in there about coordinating a scientific effort to put the best science forward. And then there was nothing in there really about how the states can get on a methodical science-based plan to get back online. And so that's what our plan supplies. We put it in on Friday, and it would create a health equipment production board, which is based on the war production boards of World War II and prior times. One of the tragedies of this process has been we've pitted the states against each other. So Maryland is in a war against Virginia and Wisconsin and Florida and California to get stuff. The counties are in a war against each other. That's like the Articles of Confederation before we even had a constitution and we had a federal government to try to coordinate it. So the federal government should take over that process and guarantee to the states that you will get in each of the state capitals the PPEs that you need for all of your counties and cities and towns. We'll guarantee that you will get the ventilators you need instead of the federal government, pitting us in a competition against each other. Next, we're going to set up this process where the states will apply for reopening approval and funding from the federal government. What do you need in order to apply? Well, there are two scientific criteria that need to be met. One, the hospitals have to be able to successfully meet the demand of the crisis so they're not overwhelmed. And then two, and more importantly, the direction of the coronavirus curve has got to be going downwards rather than up. And what does that mean? It means that the rate of transmission is below 1, which means that each person who has it is infecting no more than one other person hopefully nobody, but certainly less than 1, 0.8 or 0.7 or 0.6. But if you go above 1, if each person who's got it is infecting more than one other person, like 1.4 or 2.3 or 3.6, you got an epidemic. So the states are ready to start reopening once they've broken that curve and it's going down rather than going up. And then they apply to the government and they say, here's the strict testing protocol we're going to have for frontline health workers and for people in grocery stores and so on. Here is the contact tracing we're going to do when we find somebody's got it, and we've got to be militant about the contact tracing to make sure we know everybody they came in contact with. 3, we're going to isolate, and 4, we're going to treat people who are in that situation. And 5, we're going to have other social distancing and public health protocols in place so that we're generally following the right hygiene to put the virus on the run. And the HHS will accept petitions, applications either from one state or from groups of states. So like Maryland could get together with Virginia and DC and Pennsylvania. So we have a regional approach and we're working together. That is cooperative strategic federalism. But it's wrong for the federal government's position to be either we're King Kong and we're going to tell you what to do, or else we're an innocent bystander and we're a spectator and we're going to sit back and let you see what happens. That's not a responsible way of going about getting America back to work.
Have you passed this by Dr. Fauci or Dr. Birx?
Well, it's drawn from the best wisdom of Dr. Fauci and Dr. Birx and the other public health scientists and epidemiologists who are working on it. We have made it available to the administration. I'm hoping everybody can gather around it. Now, the problem is that up until this point, the administration's position has been, it's basically up to the states. The states are in charge of testing. The states are in charge of contact tracing, and we'll throw in some advice every now and then or whatever. Again, Sherry, I don't think it's working because one state does one thing, another state does another thing, and we could have the best plan in the world in Maryland, but if they're not doing something similar and coordinated in Delaware and Jersey and Pennsylvania and Virginia and DC, we got a real problem. That's why we've got a constitution and a national government. It's to coordinate us all together. And I do think it's the responsibility of the federal government to pay for it. Once a state shows that it's on the right path and it's got a real plan, then the federal government should be behind them. That's the real power we've got in the federal government, the power of the purse, the power of funding. And we should be funding it and not further taxing the state and county and local governments.
So I understand what you're saying. And did we lose you? Oh, there you are. I understand what you're saying. You're here in Maryland, but you got all these other congressmen and so on around the country, although you did have to come back to vote on the bill yesterday. How realistic, though, Congressman, is your act? Are you confident that something like this is going to pass?
I mean, I think it's the only realistic thing. I think people are beginning to wake up to the idea. I'm looking at a headline in this morning's Washington Post. With shifting advice, Trump sows confusion on opening. He made it sound like everybody opened. The Georgia governor said, great, we're going to reopen. Then he said, no, you're not doing it the right way. On Wednesday, then on Thursday, he said, I'm glad that Utah and Tennessee are moving to opening, but everybody's doing their own thing. And that's not going to work because this virus recognizes no state borders. It crosses the borders. So we need to make sure that the rate of infection is going down everywhere. The rate of transmission is going down everywhere. And the truth of the matter is, once we get America's house in order with the Reopen America Act, we need to be coordinating with other countries because it's not going to work if we have people coming from other countries and we're infecting them. Or more likely, since we're number one in coronavirus now, us leaving America and going and infecting other people. So this virus is a global threat. We got to think about this as like, World War Zero. This is ground zero for us in terms of being able to get back on our feet, in terms of our agriculture, in terms of industry, in terms of education, in terms of everything that makes life worth living for us, our families, our health,
The bill that was signed, or what was approved rather yesterday, the $484 billion, I can't remember what stimulus package that is. The president is expected to sign it today. That will only help help me out here, hospitals, and our
Yes,
hospital desperately needs it, and
yes,
it will continue the unemployment, small business loans. I
yes.
know you've been to Frederick County. I know you've eaten at our wonderful restaurants. Um, what's next after this bill to help? Remember how the first or the second one gave a cash payment?
Yes.
Do you have any more of those coming, or is it over?
Well, but I certainly support the legislation to continue cash payments because our people are up against the wall. And we need to do whatever we can to provide further economic sustenance. What we passed yesterday puts more than $375 billion back into this PPP program for the small businesses. To get the money, they get 2.5 times their monthly payroll. If your payroll is $100,000, you get $250,000 in a forgivable loan. It's forgiven at the point at which the loan comes due, but you're showing that you're employing the same number of people who you were employing before the crisis started. So all that is to the good, just like the unemployment insurance. We put in $600 a week extra to get people up to around 100% of what they were earning before. But remember, that to me, that's like an economic ventilator. That keeps us on a lifeline, but we can't pass trillion-dollar bailouts of the entire economy every 4 weeks or every 6 weeks. The money's going to run out. We're going to pile so much debt on future generations. It will be staggering and insufferable. We need to put the economy back in business. And the way to do that is we've got to get the virus on the run. We got to kill the virus. And that means radically expanded testing of the population, militant contact tracing of people who are infected, everybody that they've been in touch with, and then rigid social distancing protocols. And then we need careful rules as we reopen everything from bowling alleys to restaurants to workplaces to K through 12 to universities and so on. We can do this. We've got the greatest know-how and expertise in the world. But what we need is a plan. And right now, Cherry, we don't have a plan. And anybody in the military will tell you, if you don't have a plan, you're going to lose your fight. Just like anybody in a football game will tell you, if you don't have a plan, you don't know where you're going.
Something disturbing by the leader of the Senate, Mitch McConnell, regarding there's no money in this latest stimulus package for the states that are just bleeding, like the federal government. What do you say about that, especially when he talks about blue states? What does that mean for Maryland? What does that mean for Frederick County?
Thank you for pointing that out, Sherry. It's a tragic situation in two ways. One, in terms of it being a real betrayal of American federalism. When the founding fathers designed the Constitution, they knew that there would be a healthy interplay among the federal government and the states and the different branches. But the idea is that instead of having a king, a monarch, and a dictator, which is a recipe for disaster, we divide power up, but we get the different components to work together. And we've been able to get through World War II that way, and World War I, and the Civil War. And we've been able to get through the Great Depression that way, working together. And now suddenly we've got this idea that the federal government just gives the finger to the states and says, oh, well, you go bankrupt if you can't handle this crisis on your own. I mean, what a terrible betrayal of our constitutional design. We're one country. We're the United States of America, not the disparate states of America, right? But I also don't like this partisanship that you point out, Sherry, the idea that, oh, well, we're a blue state, and so we don't care about you. Well, that's terrible. I mean, Frederick County has lost 35 of our people, our human beings. We got more than 700 people in Frederick County who are infected with the disease. I don't care whether they're Democrats or Republicans or independents or libertarians or socialists or whatever they are, those are our people. We're going to take care of them, and we've got to have that kind of commitment. So to have one of our top officials, the Senate Majority Leader, out there saying, well, people from red states shouldn't care about people in blue states, and people in blue states shouldn't care about people in red states. My God, why did we have a civil war? Lincoln wanted to establish that we are one country, we're one union. And so that's just a dangerous way for us to think about it.
We don't have a lot of time left, but I do want to touch on the Maryland delegation's $45 million COVID-19 for child care centers.
Yes,
Are you on board with that? And what is that?
I'm very much on board with it. Look, it's a special supplement of 45 million for daycare. And I can hear people saying, daycare, that doesn't seem like that's really front line of the struggle. But think about this for a second. All of the people who are on the front lines, the firefighters, the first responders, the doctors, the nurses, the public health people, they need daycare for their kids. And that's what this 45 million supplement is for, so that the people who are out there fighting are able to have their kids taken care of. And so we got to think about our daycare providers, like our bus transit drivers and our grocery store clerks, as part of this struggle too. We are all in this together.
You know, when you think about going back to the Mitch McConnell's suggestion that some states file bankruptcy, and this is a rhetorical question, but my gosh, think about our local police, teachers, public servants that would be laid off if something like that were to happen. It would just be devastating.
Yeah, I mean, I'm hoping that we're going to call our next round of legislation the HEROES Act for the cops and the firefighters and the first responders, the nurses, everybody who's on the front lines. I mean, that's when we say state and local government, maybe that seems too abstract to people, but it's not abstract when we're talking about the firefighters who are coming to rescue people in the middle of the night. It's not abstract when we're talking about ambulances to get people to the hospital. I mean, that's what makes America run. We can do with or without the investment bankers and the private equity investors and so on. Those people have already gotten hundreds of billions of dollars. We cannot afford to pull the plug on state and local governments. So I'm with you. You know, I remember there was a headline when I was growing up. I can't even remember which president it was. It may have been Gerald Ford, but the headline was like President to New York City dropped dead. And I don't want to see headlines saying Mitch McConnell to state and local governments drop dead, go bankrupt. That's not the America that I know. That's not the America that I believe in.
Congressman, I appreciate your time this morning. Where do you want to leave it right now? I know I'd love to be able to follow up with you on
Yes.
see how you're going with the Reopen the America Act 2020. I'd like to follow up with you on that. What's next now in the immediate future?
Well, as you can understand, it's awkward conditions trying to organize legislation under these circumstances. And I do hope in better days we'll be able to meet in person and do a real face-to-face interview. But I'd love to stay in touch with you about it. And I'm spending all day on the phones doing conversations with colleagues. We're going to meet with Governor Cuomo to talk to him and some of the other governors. I've been in touch with Governor Hogan's staff. I'm hoping to talk to him about the fact that we are presenting a framework at the federal level to really help these great governors. I mean, Governor Hogan has been magnificent in this process. Yeah. Governor Cuomo's been terrific. I mean, these governors have really been on the front lines, but they need help, and they shouldn't be pitted against each other in a competition for material and resources.
And let's not forget, Governor Hogan is a Republican, Governor Cuomo is a Democrat. We're all in this together.
We're in it together. Thank you for saying that, Sherry.
Well, thank you for joining us today, Congressman Jamie Raskin, who is our congressman right here in Frederick County. We appreciate your time, and we hope you stay well and healthy.
Hang tough, everybody.
And I'm Sherry Graziosi. Thank you for joining us. I'm with the Frederick Scanner.